Hello and welcome to Back to the Science. I'm Dr. Susan Oliver and I'm a scientist, and this is Cindy Oliver and she's a dog. Okay, so a couple of weeks ago I made a video about nurse serial killer Lucy Letby, which showed that some of the claims being made by her supporters were wrong. Predictably, I got a number of comments from Letby supporters making the claims that I had just shown were incorrect. How to prove you didn't watch the video before commenting. Anyway, I did also get a few people asking about the claims being made by a neonatologist at a recent press conference organised by her new barrister. The neonatologist was Dr. Richard Taylor, and he claimed that one of the babies that Letby was convicted of murdering was actually accidentally killed by a doctor. Now, before we go into the claims, I just want to show you another clip where Dr. Taylor explains why he first decided Letby may be innocent.
No, I'm not. Obviously, I live in Canada, and so my introduction to the Lucy Letby case was on visits to the United Kingdom, and so the first I heard about it was last year during the trial. I was incredibly surprised because if you look at the history behind this and you look at Lucy Letby herself, you see a nurse, and nursing is an altruistic profession where people, especially in this country, nurses don't go into it for the money. They go into it because they want to help other people, almost universally, and I think that applies to her. She has no past history of any antisocial behavior, any criminal behavior, any psychiatric problems at all. There is no motive. Her friends are all completely astounded, flabbergasted by the accusations that were made against her, and so that immediately for me brought up red flags.
So, in other words, Dr. Taylor was predisposed to thinking that Letby was innocent before he knew anything about the evidence against her. And the reason for this is because he thinks all nurses are nice. He also appears to be under the misapprehension that all her friends still support her. Some of them definitely do and have spoken to the media about this. But a number of the doctors and nurses who gave evidence against her at the trial had been her friends before they found out she was a murderer. The important point, though, is that Dr. Taylor, as well as the other two neonatologists whose report he summarises for the press conference, all believed in her innocence before seeing any of the medical records. Anyway, let's listen to Dr. Taylor's claims.
So, with regard to these reports, I've only read one of the reports in full, and that is the report on baby O. I should qualify this by saying that I have not seen the medical records myself, but I have read the full report. And to summarize the medical evidence, baby O was doing reasonably well. There had been some concerns with abdominal distension, which was possibly related to excess gas going into the gastrointestinal tract. The baby had an apnea, and the medical staff, an apnea is a pause in breathing, and the medical staff responded to this by intubating the baby, placing the baby onto a ventilator, and the baby was not unwell particularly, but it had an apnea, but they placed the baby on a ventilator and then put the baby on very high pressure settings. So in neonatology, when we ventilate babies, we ventilate by pressure rather than by lung volume, and this baby was placed on very high pressure settings, inappropriate for the fact that the baby actually had no lung disease at all. So the baby was being ventilated on very high pressure settings. Again, the nurses were concerned that the medical staff had actually left the unit They then came back. Things didn't look quite right, and to summarize what happened, the nurse was again concerned that the abdomen was distended, and one of the doctors responded to this by placing a needle into the abdomen. So they directly aspirated the abdomen, and they chose to use a point which in medical parlance is called McBurney's point. This is a description of the point that is used for performing an appendectomy. The baby did not need an appendectomy. This is a newborn. Appendectomy is completely irrelevant to it. If an aspirate was going to be attempted, it should have been done on the left side, but in fact the doctor used McBurney's point, which is on the right side. As I have already said, the baby was on very high pressure settings, and this is confirmed by an X-ray of both the abdomen and the chest. And the settings were so high that the baby's liver was pushed right down into the pelvis. So when the doctor performed the aspiration of the abdomen, the needle perforated the liver. The baby was still being ventilated with a needle in the liver. The liver was now being lacerated by the needle. And this led to bleeding, free blood going into the abdomen. The baby went into shock. The shock was actually confirmed by a subsequent blood test which showed that the baby's hemoglobin had halved, and they were unable to resuscitate the baby, partly because they didn't realize what they'd done.
What was the name of the doctor?
I don't think it's right that we name names at this stage.
I think the doctor knows who they are.
We don't.
I know. I have to say, from a personal point of view, that if this had happened to me, I'd be unable to sleep at night, knowing that what I had done had led to the death of the baby, and now there is a nurse in jail convicted of murder.
Having looked at the evidence, how strong do you think the evidence against Lucy Letby is compared to your theory? That, as I understand it, the doctor accidentally killed the baby by mistake.
The claim was that I think that Lucy Letby had injected air into the baby. I'm not even sure what the prosecution was claiming, but it's nonsense. Complete nonsense. The baby died from shock, from a liver perforation.
How confident is the team in this, that this is what happened?
The report stands out, and I understand that the report is partly based on, well, it's fully based in fact on the medical records, and the medical records actually include a statement that an aspiration of the abdomen occurred at McBurney's point.
Is it surprising that that wasn't discussed in court?
Very surprising, yes. I don't think that the case was reviewed very well. It's also surprising that it didn't come out in the autopsy. But I understand that the information that an attempted aspiration of the abdomen had been made, this was not conveyed to the pathologist. The pathologist was unaware of that.
Now, if you haven't taken an interest in the Letby case, this probably sounds pretty convincing. And you're wondering how all the experts who did see the medical notes, x-rays and post-mortem photos missed all this obvious stuff. If you have taken an interest, you are wondering why this guy is commenting on a case when he doesn't even know the basics about it. Now, I'll start with his ridiculous statement at the end that the pathologist wasn't told about the needle procedure. We know this isn't true, but even if it was, the pathologist has the body. They can see the puncture wound. In fact, the paediatric pathologist Dr. Manarides, who gave evidence at the trial, discussed the possibility of a needle injury to the liver and explained in detail why it was inconsistent with the actual damage to the liver. And I will just read you what he said, and this comes from a transcript that was purchased by the owner of the Crime Scene to Courtroom channel. The prosecutor, Nick Johnsons, asks, a further issue that was raised, and you deal with this in your report on 20th of October 2021, has been whether or not a decompression with a cannula at McBurney's Point, which the jury will remember was carried out by Dr. Breary, whether that type of intervention could have caused the injuries that we've seen in those photographs. Dr. Manarides answered, I don't think so, and I'll explain why. So a drain is a tube that is entered into the abdomen. Can I go back to the photographs, please? Dr. Manarides explains further. So for the tube entering the body of the baby to cause a bruise, it needs to contact the liver. There's no other way it can produce it. If a tube was to cause an injury to the liver, one would expect that there would have been a perforation type of injury. It's like stabbing the liver with the tube. That's not what we see here. What we see here is something that has pressed against it. So a perforation type of injury would look like this, for example, what I'm showing here on the right-hand side of the liver, okay? It wouldn't look like this. Is this a perforation type injury that occurred due to this drain being inserted? My answer is highly unlikely. The reason being there is no significant injury, hemorrhage associated with that. One would expect hemorrhage around that should this have been while the baby was still alive and there was circulating blood. And obviously he's explaining this with photos of the liver. The prosecutor then clarifies. So just so we can clarify, is there a perforation injury noted in the notes from the post-mortem first of all? Dr. Manarides says, no. The prosecutor then asks, so you're going off the photograph and that thing that you can see where you have the cursor looks like it might be? Dr. Manarides then explains, yes, this looks like it could be a perforation type injury, and there are two explanations for that, three actually. We will discuss them. The first explanation, this being a perforation type injury from the drain. I think this is unlikely because there is no surrounding bruising, which one would expect to see while the baby was alive. One would expect to see the colour that you see here around this area. Explanation number two, they inserted the drain when the baby had no circulation. This is not my understanding from the clinical notes. Explanation number three, this is a post-mortem artefact, probably when the liver was being removed from the baby's body, maybe a scalpel, maybe something else that was there on the PM table caused this. The appearances of these are of a post-mortem injury rather than an injury that occurred in life. But if that drain indeed caused injury to the liver, I would expect to see hemorrhage of this colour around that, and it would have been a perforation. The other thing that cannot be accounted for with this pattern of injuries is if one was to accept that the drain was inserted, touched the liver, did not perforate, but caused a bruise, to generate bruises on the right side, the left side, the underside, the top side, you need to have repeated such episodes, which is not the description, and it's highly unlikely that if you had repeated efforts of somebody trying to resuscitate a child, they would have on all occasions caused bruises but not perforated the liver. So no, I don't think it is a plausible, reasonably plausible explanation. So what Dr. Manarides is saying is the only mark that he saw on the liver that possibly could have been caused by a cannula occurred when the baby had no circulation because it didn't bleed. So Dr. Taylor's hypothesis doesn't explain the bleeding and it doesn't explain the injuries. If the hypothesis was correct and the liver did manage to get displaced all the way down to the appendix, despite the abdomen already being full of air, the liver injuries would have been confined to the bottom right of the liver. But they weren't. And the injuries would have looked like injuries caused by a pointier object, but they didn't. Now, Dr. Taylor also mentioned the blood found in the abdominal cavity, and there certainly was blood found there. 25 millilitres, in fact, which is quite a bit for a premature baby. The pathologist, Dr. Manarides, estimated that the baby's total blood volume would be about 192 millilitres. What Dr. Taylor didn't mention, though, was that there was an additional 20 millilitres of blood in a blood clot on the liver, which doesn't fit the narrative he's trying to tell. Although, to be fair to Dr. Taylor, he probably didn't even know about the blood clot. Now, Dr. Taylor claims that the baby died from shock from blood loss, and there is no doubt that the blood loss contributed to the baby's death. But shock is irreversible when a baby loses 40% of blood volume. Based on the blood in the abdominal cavity and the blood in the clot, the baby had lost 23% of his blood volume. And we also know that at least some of the blood volume loss was replaced by fluids as the hemoglobin was down. By the way, the cause of death determined by Dr. Manarides was inflicted traumatic injury to the liver, profound gastric and intestinal distension following acute excessive injection of air via nasogastric tube, and air embolus from administration of air into a venous line. And evidence of all three was found. So the key claim made by Dr. Taylor at the conference is bollocks. But believe it or not, he said a few other things that are also bollocks. For instance, he said the doctor used the right-hand side for the decompression procedure when he should have used the left-hand side. The procedure the doctor used is called abdominal paracentesis. And as this guideline explains, you can use either side of the lower quadrant. Dr. Taylor also claims that the baby was doing reasonably well prior to being put on a ventilator. Well, this was certainly true in his first 2 days of life when Letby was on holidays, and it was also true in the morning of Letby's shift when she had a student nurse sticking to her like glue, and that's a paraphrase of her words. But Letby managed to palm the student off onto other nurses at about lunchtime. At 13:15, Letby was alone with the baby when the baby started vomiting and was found to have a distended abdomen as well as fast breathing and heartbeat. She called her favourite doctor, who determined from the blood gas that the baby had mild mixed acidosis. Acidosis means that the baby's blood was more acidic than it should have been. And mixed acidosis means a combination of respiratory acidosis and metabolic acidosis. There are many causes of metabolic acidosis, but one potential cause is blood loss. Anyway, the baby was put on IV fluids as a precaution, and Letby was left alone with the baby again. Then at 14:40, when Letby was alone with the baby, in Letby's words, child O had a profound desaturation to 30s, followed by bradycardia, that's a slow heartbeat, mottled ++ and abdomen red and distended. Transferred to nursery 1 and neopuff ventilation commenced. Perfusion poor. And poor perfusion means that there's not enough blood getting to all the vessels. And this is what Dr. Taylor described as the baby had an apnea. We also know that prior to child O's collapse, a colleague said of child O, he doesn't look as well now as he did earlier. Do you think we should move him back to room 1 to be safe? And Letby did not agree. So the baby was left in room 2. Room 1 was the ICU, and if the baby was moved there, it would have had better monitoring. Anyway, the baby was successfully resuscitated after the collapse, and it was moved to room 1 and placed on a ventilator. Once the baby was stable, the doctor left to update the parents, leaving Letby alone with the baby. And you're not going to believe this, but the baby collapsed again when Letby was alone with it. What are the chances? And that's a desaturation bradycardia that you can see at 1551. The baby was reintubated again, but he continued to deteriorate. The deterioration included the acidosis getting worse, which they attempted to treat with sodium bicarbonate, and low blood pressure, which they attempted to treat with dopamine. The ventilator pressure was increased at 1619 following a further collapse. By the time the needle decompression procedure was performed, the baby had already been baptised and was only being kept alive by CPR. So Dr. Taylor's description of what happened with baby O is, shall we say, a bit misleading. He also seemed to be suggesting that the 5 doctors who were involved in the resuscitation didn't know what they were doing. Of course, he doesn't really know what they did because, as he admits, he hasn't seen the medical notes. And he didn't even know that the liver injury was identified as one of the causes of death at the trial. I am guessing that he also doesn't know that a senior neonatologist from Arrow Park was contacted during the resuscitation and he agreed with the management so far. This was after the ventilator pressure had been increased. And then we have this interesting tidbit from messages between Letby and Dr. A. And this also comes from the transcripts that were purchased by the owner of the crime scene to courtroom channel. Dr. A at 1:32. There was a liver capsule hemorrhage in baby O. It is thought to be related to resus disease process, but doesn't explain the deterioration not on the first X-ray. It's not considered by SB and redacted to be significant. There will be an inquest. We may have to attend. Lucy answers, would he have died from that? Dr. A says, I don't think so. He collapsed. The liver on the first X-ray looked normal, done in nursery 2, and looked abnormal on second X-ray to confirm tube position. But the CPR was needed for something. It doesn't explain why liver changed appearance. So we have the liver looking abnormal before the decompression procedure was performed, but not before Letby was able to be alone with the baby. But wait, there's more. This is an excerpt from the prosecution's closing argument regarding baby O. There was no response to a resus that lasted for more than half an hour. The blood gas proved that there was not a respiratory cause. It was not a breathing issue that caused the collapse. The hemoglobin was down, but not so low that it would have been expected to have caused the collapse that was witnessed. So the hemoglobin was already down before the final collapse, but the decompression procedure wasn't undertaken until after the final collapse. And as Dr. Taylor explained, low hemoglobin is evidence of blood loss. So in summary, 2 neonatologists who had already decided that Letby was innocent have attempted to put together a story to explain the facts that doesn't involve Lucy Letby. A third neonatologist who doesn't even know the basics of the case has conveyed that story at a press conference. The only problem is that the story doesn't really fit the facts of the case. If you'd like to look further into the data I presented, I provided links in the video's description. And please remember, this video is about science, but you shouldn't take it as medical advice. For that, you should speak to your medical practitioner. If you've got this far, thank you for listening. And if you've liked, shared, or commented on the video, double thank you, because that helps the algorithm and means that more people will see the video. And of course, thank you to everyone who has bought me a coffee or little sleepy Cindy here a treat. We really appreciate your support. We will be continuing to make videos about the science in the future. So if you'd like to join the cool kids and stay informed, please hit the subscribe button. Thank you.